I qualified in 2011 and I've been working for 2.5 years in intensive care in Barnsley, and then I started work at Manor Park Surgery as a practice nurse in May.
My background before coming into practice nursing was the young adult oncology unit. I was there for 6 years, and the liver unit before that. I was qualified for 9 years before I came into practice nursing.
My background before coming into practice nursing was nothing really. I came straight from university. The week after I qualified, I started as a practice nurse, and I have now been a practice nurse for coming up to 4 years.
Well, after working for such a long time in intensive care, I started to feel that I wanted to help patients more before they got that poorly, rather than looking after them as they're really, really poorly.
I chose practice nursing as a career because from a lot of my placements in the community, I loved the diversity, I loved the community setting. My last placement was with a practice nurse for 4 months, and I fell in love with the job. I just loved everything about it.
Probably the diversity is one of the biggest challenges. You never know quite what's going to walk through the door. There is so much to learn, but that's always a good thing, especially when you're so well supported. I had a structured induction following the RCGP competency framework, which will take me about 12-18 months to complete all that.
The massive knowledge you've got to know about all the different things like A-care, smears, all your chronic illnesses and your baby immunisations. And I think as well, when you face a problem, there's not always a simple answer. There's a lot more to it than what you think.
My biggest achievement is just passing my nurse prescribing course. Up until that point, I've been doing course after course, and I feel the learning is endless. There's so much knowledge to gain from courses.
Today, I think my biggest achievement is giving baby immunisations without being terrified and shaking.
Probably my biggest achievement has to be getting up and going with my clinics on my own, of managing my own patients and having patients come out of a consultation happy with what I've done for them.
I think I was prepared for the diversity of practice nursing, as I say, having my final year, being in the community, but it has been challenging, and I think there's a lot of communication skills to gain through the diversity of patients. Understanding the way they want to discuss something with you would be completely different from one person to the next.
I wasn't really prepared for the diversity of practice nursing, I don't think. I knew the basics of it. I didn't realise how much more there was. Like, there's a lot of learning to go on and loads of study days that you can access to continue your knowledge, and I think you always need to be up to date, and because you're not in a second care setting where that information's brought down from the top, it's more going out and seeking that information yourself.
For anyone wanting to come in or thinking about coming into practice nursing, I'd say go for it. It's a really good opportunity.
If you want to be a practice nurse, I would say absolutely go for it. There's no need to start off in the hospital setting. If you are dead set on being a practice nurse, you need to stick to your guns really and go for it.
I think it's a good idea to take someone in from different cares and different backgrounds, because they always bring new things to the table, and even if you've just qualified, there's always things you've learned as you've been training that you could bring to the table as well. And I think the main thing really when you're employing a nurse is finding the person that fits your team, rather than thinking about their experience.
In the next 12 months, I plan on becoming a nurse mentor, so I plan on taking on student nurses and be able to mentor them in practice. And I want to work towards getting my masters through doing the mentorship and the prescribing course. They've both given me credits towards getting my masters in the future.
In the next 12 months, I'm planning to complete a course at Sheffield Uni that's called Introduction to Practice Nurse, which really has all the study days that you can access all in one year, all in one place. And I know that Leeds are also working towards doing this kind of a scheme, and hopefully from there going on to doing the chronic illnesses.
Complete the RCGP framework competency. I'm currently about to start my cytology course, and I've got lots of other courses already booked up and lined for, so finishing that clinic knowing that you've helped somebody with something that might feel pretty mundane at the start of it, but is actually pretty big for them.
Good day for practice nursing for me while I'm still early on in me starting the career really is a smoothly run clinic where at the end I'm really well organised and everything's gone well, and I've hopefully made a difference to some patients.
A good day in practice nursing for me is having a patient walk out happy, is having them really, really pleased with the service that you've given them. A fantastic day is having somebody's wound heal, them walking out and it's healed and they don't have to come back again, or it's changing somebody's inhaler so that their asthma is better controlled. Just giving the patient more independence, increasing their health.